Hello. My first thought of hearing all the stories of the families is that it was heartbreaking. I have a child and cannot imagine experiencing what some of these families have been through. It was great hearing the medications with the multiple checks and procedures that they follow now with advances on the IV pumps. The takeaway is to always double check and triple check your medication. And if you're still not sure, to check with other supervisors and doctors and ask if you're not sure. Taking 1 minute will help ensure the safety of the patients that we serve. Lasting impression is to ensure the quality of care we provide is measured by the safety we as healthcare team members take with each patient we care for. Safety is described in Kelly et al. As the process of minimizing risk of harm to patients and providers through both system effectiveness and individual performance, and that's on page 340. Safety, quality, safety, and education for nursing competencies that we must keep on the forefront of our minds when we are caring for patients. This can be from giving patients their medications or helping plan out the outcomes of their interventions or working with other healthcare team members that care for this patient when they provide the quality care to them. An example of a safety measure that was seen at my agency is medication giving to older adults. A couple of the PM nurses would just leave the medication in a medication pill container for them and take them when they're ready or because they take pills slower. And so as a PRN nurse, I'm not there every day. So on the mornings that I would see a pill on the floor, I don't know when or what day, if it was from the night before or what day it was from. So ultimately, I would have to report it anyways, but just knowing that we're not sure what day it was. So I would have to report it and watch the patient depending on what medication it was. This could be their blood pressure medication or a warfarin or antibiotic. And although some could see this as minor, as an older adult, their body systems can be a little bit more complex with the metabolizing of the medications in their body system. So that's always having to be taken into consideration. The sharing of this knowledge will help ensure that the agency puts into effect a protocol to ensure that all nurses are staying and observing and watching the older adult residents take their medication as they are signing it off in the medication administration record. So we have to be sure that this is being done correctly.